Hey everyone, it's Dr. Carl Baird at Evolve Performance Healthcare. Today we're talking about steroid injections and reasons for you to avoid steroid injections, even if it's something that your doctor has recommended for you. So odds are if you've gone to your medical doctor, primary care doctor for anything pain related, they're gonna recommend, if pain pills aren't working, the next step that they go to are steroid injections. And again, a lot of times they make these recommendations and they either conveniently leave out some of these long-term side effects or long-term consequences that steroid injections can have, or they kind of brush over them and pretend like it's not that big a deal when in reality it actually is a pretty big deal. So with that being said, we'll just get right into it. So the very first thing that steroid injections can do is they actually weaken the tissues that you're injecting and can lead to another tear or worse off, a rupture. So this actually happened to a woman that came in. She was a racquetball player and tennis player her whole life, repeatedly rotator cuff tears. Her doctors kept telling her, get injections, get injections, get injections. So by the time she came to us, she'd already had 4 injections. The pain was really, really bad still, because again, injections, all they do is numbing the pain. They're not really fixing the problem. And then she went and got an MRI, and then she came back to us, and guess what? She had a full rupture of her biceps tendon. And again, it's partially because those injections weaken those tissues. And again, so when she got those injections, the doctor never mentioned any side effects that, hey, this might actually weaken your tissues and lead to worse outcomes later on. And so now she's stuck and she's getting a surgery to repair a fully torn biceps tendon. So if you're thinking about getting an injection, keep in mind that if you're doing it for a shoulder or anything outside of a joint, a tendon, a muscle, that it's actually going to weaken that muscle or tissue that you're getting injected in and can possibly lead to future complications later on down the line. Number 2 is it can damage cartilage. So the other thing they like to do is they actually like to go inside joints and put the steroid in joints. Knee is probably the most common one. But again, they don't mention that this leads to cartilage damage. So yes, it's going to numb the pain and your knee is going to feel great. By great, just not in pain. But you're actually doing damage to your cartilage. So once the steroid wears off, you're going to have more problems. Your osteoarthritis is still going to be there, and you're actually going to have a worse cartilage that's going to lead to more issues later on down the line. And then they're going to recommend another steroid shot, until, again, their third step is usually surgery, where the steroid shots aren't working anymore. So now your cartilage is totally messed up, so go and get a surgery. So again, keep in mind that if you're shooting it inside a joint, it's going to damage your cartilage, and that can lead to complications later on. And the fourth is that it doesn't actually fix the problem, right? So again, the steroid injection is specifically meant to handle pain, but it doesn't fix the cause of the pain. So once the steroid wears off, well, your pain comes back and you're kind of right back where you were with, again, weakened tendon, weakened cartilage, without really any fix to your problem. So if your pain is keeping you from hiking or running or doing whatever it is you like to do, once the steroid wears off, you're not going to be able to do that thing. And so we got to keep in mind that, again, most people's cause of non-traumatic pain is movement and strength. Those are the causes. And if you don't address that, the steroid is a temporary relief, but it doesn't fix the underlying issue. And then once it wears off, you're going to be right back where you started. So those are 3 reasons to avoid steroid injections. Again, I'm not saying yes, do it, or don't do it, but I at least want you to have all the information when you're making that decision for yourself, because again, this is something most of the time from our experience, when I explain this to a patient, they've never heard that information before. So again, keep that in mind. Steroid injections can weaken tissues, damage cartilage, and won't solve your problem in the long run. If you have questions, check out the article below in our bio, and I'm happy to answer anything you got. Thanks.